Hi, my name is Katie Sherlock, and I'm an occupational therapist here at the Hoag Orthopedic Institute. As an occupational therapist, it's my job to make sure that my patients can manage what we call the occupations or activities of daily living. Things like bathing, dressing, getting to the bathroom, and those kinds of things. Now, everyone's here having surgery to make those kind of things easier for themselves. So when we talk about adjustments or adaptive strategies or adaptive equipment, we're talking about that short-term recovery time until you get past the pain and until you regain the flexibility that you would like to have. Let's start by discussing some ways that you can make you and your home as safe as possible for after surgery. The first thing I recommend is to get your arms as strong as possible. Included in your handouts is a list of some arm exercises. The most important one that I'd like to show you is what I call a seated push-up. For this exercise, you'll sit in a chair with arms, put one hand on either armrest, and push through your arms to lift yourself up and out of the chair. I like this exercise in particular because it works the specific muscle groups that help you to get in and out of a chair, in and out of bed, or to push down on a walker after the surgery. Let's address a few things that you can do to make your home as safe as possible for you after surgery. What this comes down to is preventing falls. No one wants a preventable setback after their surgery. It's easy to pick up throw rugs. Anything on the floor that you might catch your foot on a good day, get it up and out of the way. I also highly encourage night lights. Even if you go to the bathroom several times a night, it's that much safer to have a lit path. Also, you will all use a walker after surgery. Some of you may only need it for a day or two, but you might be going home with a walker for up to a couple weeks. So it's nice to make sure that you've got room around your house to negotiate with a walker. That might mean moving a coffee table a little bit or shoving things a little bit side to side. Along with a walker brings up the point that it takes two hands to use a walker safely. That doesn't leave you in hand to carry anything. So it might be nice to have a bag of some sort, basket, or tray that you can hook to the front of the walker to hold the things that you might need to get around. If you're going to prepare meals or have drinks ahead of time, highly recommend something with a lid to it. If you've got a lid on it, it's not going to spill. If it's not going to spill, you're not going to slip in it. And then it makes you and your home that much safer for after surgery. Besides the front-wheeled walker, let's discuss some other equipment that might make your life a little bit easier before and or after surgery. This is a 3-in-1 commode. Unfortunately, most insurances no longer pay for this, but I like for you to know what it is so that you can make an informed decision what you'll need after surgery. We call this a 3-in-1 commode because it serves three purposes. First of all, it can sit over top of your toilet. It gives you a little extra height and the armrest to make it easier to get up and down off of a very low surface. Toilets tend to be the lowest place in the house that you sit. Unfortunately, they're also the most important place in the house that you sit. So if you've been having difficulty getting up and down off a standard toilet, this might be the answer for what you need. This also works in a shower. It can serve as a place to sit down in the shower, and it comes with a bucket. You can put it next to the bed if you weren't able to get all the way to the bathroom in the middle of the night. This is by far not the only piece of equipment out there. This is just multifunctional, so it makes it easier to recommend one piece. They also make raised toilet seats that just sit on top of the toilet themselves, as well as shower chairs, which are just little stools that would fit in the shower and give you a place to sit. There's also a third type, a tub transfer bench. It's partway in the bathtub, partway out of the bathtub, that would allow you to sit down and scoot yourself into the tub without having to climb over. Now, we recommend the first time that you practice getting into and out of your bathtub or shower that you wait until the home health physical therapist comes out. You can do this once with them as a dry run. Make sure you have a safe way to get in and out of your shower, and that way you're prepared to shower on your own. The other adaptive equipment that I have to show you is designed to make it easier to reach your feet. Usually by the time you get around to having knee or hip surgery, one of the more difficult things to do is reach down and put socks and shoes on. The first thing I have here to show you is a long-handled sponge. So it's safer to use that to reach down and wash your legs and your feet than it would be to stand on your surgical leg and try and balance to wash your non-surgical leg. This is a long-handled shoehorn. So this would allow me to slip my shoe on and off without having to bend as far. This is known as a reacher. This would allow me to pick things up off the floor if there was something that I couldn't reach, but it also makes it easier for me to get my socks and shoes off or to put my pants and underwear on. When you get dressed, you want to put the pants or underpants on your surgical leg first. The side that's harder to move is the side that you want to do first. This one's designed for putting your socks on. I'm going to show you what this does because this is something that people are least likely to be familiar with. I'm going to use my reacher and I'm going to use it to take my sock and shoe off. From here, I'm going to put my sock on my sock aid. You want to pull it up to the end, but not past the end. And I'm going to gather it in the middle so that the toe part's all the way on as well. From here, I need to open it up within the sock to allow room to get my foot started. Now I go fish. Toss it to the floor, get my toes started, and pull. Then I can set it aside and use my shoehorn to slip my foot back into my shoe. Now again, this equipment is very seldom paid for by insurance. But as a courtesy, the hospital does provide the equipment in our gift shop as well as our outpatient pharmacy. They're available for $35 as a set if that's something that you're interested in. In conclusion, if there's anything that we discussed today that you'd like to work with or practice one-on-one, please ask your nurse or your physical therapist for an occupational therapy consult, and I'd be happy to go through this with you on a one-on-one basis. Thank you for your time, and I wish you the best of luck with your surgery and your recovery.